Hey everyone, welcome back to the channel. The Cognitive Keeper, your partner in cognitive health and aging well. The show where we dive deep into brain health, aging, and everything you need to know to live your best life. I am your host, Lori, and I'm excited to dive into an important topic today, memory issues. Many of us might think that forgetting where we put our keys or mixing up names is an early sign of Alzheimer's disease. But today, we're going to explore some memory problems that can easily be mistaken for dementia without the scary diagnosis. So, let's jump right in. Picture this. You had an intense week at work, juggling deadlines and family responsibilities. You finally sit down to relax, and all of a sudden, you can't remember the name of that movie you were super excited to watch. Is that Alzheimer's? Not necessarily. Memory lapses can happen to anyone, especially under stress. Stress can cloud our thought processes and make it difficult to remember even the simplest things. Chronic stress floods your brain with cortisol, which can fog up your memory. Think of it like trying to find a file on a cluttered computer. Maybe you're thinking, hey, that sounds a lot like me. Well, you're not alone, and it doesn't mean you've got Alzheimer's brewing just around the corner. Now, let's shift gears a bit. Imagine you haven't been eating as well as you'd like. Maybe you're the go-to person for takeout, and you find yourself skipping veggies because, well, who has the time? This lack of necessary nutrients can sometimes lead to memory issues. Not getting enough vitamin B12, for instance, could make you feel foggy and forgetful. It's like your brain is trying to run on empty. So next time you can't recall what you had for dinner last night, consider checking in on your diet. How about this one? Have you ever felt unusually fatigued or noticed some changes in your mood? Maybe it feels like you're constantly running on low battery. You could be dealing with thyroid issues, which can mess with your mental clarity. Your thyroid plays a huge role in regulating energy levels. For many, it might present as forgetfulness or difficulty focusing. If you find yourself feeling unusually lethargic and forgetful, it might be time to take a closer look. Let's talk about sleep, that wonderful thing we all crave. Imagine staying up late binge watching your favorite series. You finally hit the pillow at 2 a.m., but wake up feeling like a zombie. If you're not getting quality sleep, it can wreak havoc on your memory. We all know that groggy feeling when we can't remember what we were supposed to do the next day. And when you're operating on little sleep, your brain's ability to store new memories weakens, a perfect recipe for confusion. Next up is something many people are familiar with: anxiety and depression. These feelings can lead to what feels like a foggy brain. Perhaps you're sitting in a meeting and suddenly you lose track of what you were going to say. Anxiety can disrupt our thought processes, making it feel like your brain is running a marathon while your body is sitting still. It's important to realize this can have a profound impact on our memory. If you've been feeling this way, reach out for some support. Now let's address another serious but often overlooked point: substance and alcohol abuse. Have you ever noticed that someone you care about seems to become forgetful or confused? Sometimes drug or alcohol use can impair memory and cognition. It doesn't just affect the individual in the moment, it can leave lasting effects. Some prescriptions, like certain antidepressants or blood pressure meds, list brain fog as a side effect. If you see someone struggling, it might help to approach the conversation with care and concern. When you think about important parts of your body, the liver should be really high on your list. It's like a superhero, doing things like cleaning out harmful stuff and helping to break down medicines. Your liver also makes proteins that are needed for your blood to clot, among other important jobs. Even though the liver is strong, it can still get hurt. If it's damaged for a long time, it can develop something called cirrhosis. This is when healthy liver tissue gets replaced by scar tissue, making it hard for the liver to do its job. Cirrhosis doesn't just happen suddenly, it usually takes years of having other liver problems like hepatitis or drinking too much alcohol. Liver disease can be tricky because at first you might not notice anything wrong, which is why it's sometimes called a silent disease. Later on, you might see signs like yellow skin and eyes, called jaundice, itchy skin, dark-colored urine, swelling in your legs and ankles, and bruising easily. But liver problems can also mess with your thinking. A problem called hepatic encephalopathy, referred to as HE, can make your brain act like it has dementia. HE happens when your liver can't clean out toxins from your blood, leading to a buildup that can cause memory troubles or confusion. So if you're having problems with memory or thinking and you're not old enough for dementia, it's a good idea to check if your liver is okay. With proper treatment and medical care, many people with HE can see significant improvement in their symptoms. Your brain is 75% water. Even mild dehydration can make you feel like you're walking through quicksand. It can slow down your reaction time and make you feel less alert, which can be mistaken for the slower mental processing seen in dementia. You might find it hard to concentrate, think clearly, or remember things. Dehydration can make you feel very tired and sluggish, which can look like the low energy levels often seen in people with dementia. Because these symptoms overlap, it's important to identify the cause. If someone is experiencing these symptoms, checking for dehydration as a first step can help differentiate the cause and provide quick relief. If symptoms persist even after rehydration, consulting a healthcare professional is recommended for further evaluation. Urinary tract infections can mimic symptoms similar to dementia. Sounds weird, right? The infection can cause short-term memory issues, which are also common in dementia patients. It can cause mood swings or changes in behavior, such as increased irritability or agitation. In older adults, urinary tract infections can cause sudden confusion that looks like dementia. If left undiagnosed and treated, it can lead to delirium, a severe form of confusion that comes on quickly. Delirium includes symptoms like disrupted attention, disorganized thinking, and alterations in consciousness, which can mimic signs of dementia. Because the symptoms overlap, it's crucial for healthcare providers to consider a UTI as a potential cause when an older person displays sudden changes in mental status. So, there you have it. Memory issues can stem from a variety of causes, many of which are completely unrelated to Alzheimer's. It's essential to take a moment to evaluate your lifestyle and consider whether one of these factors might be at play. If you or someone you know is struggling with memory loss, it could be a good idea to chat with a trusted friend or a professional just to get some clarity. Remember, our journey towards better health is an ongoing process, and understanding our bodies is a key part of that. See you in the next episode. If this video helped you, give it a thumbs up. It really supports the channel. And don't forget to hit subscribe and ring that bell so you never miss our deep dives into promoting cognitive health, aging well, and busting myths. Got a topic you want us to cover? Drop it in the comments below. Thanks for hanging out with me today. Take care of that amazing brain of yours, and I'll see you next time.